Welcome back to Thanks for joining me. In the last episode on the population health cycle, we discussed the segment step and the many details that go into segmenting your population. In this episode, we're going to discuss step 4 of the population health cycle, cell. Often, I hear people talk about enrollment, engagement, or participation when considering this step. I prefer to call it what it is. It's a sale. We are selling and trying to get someone to buy into the program and continue to buy into the program. First, who do we need to sell to? Well, clearly the individual, but also the physicians and or other providers as well as organizations we're going to be working with. We need them all to be willing to work with the program. Many programs fail right here, with typical enrollment rates of 20 to 40%. Moving the needle for the population is near impossible. Perhaps you offered a wellness program and you enrolled the worried well, or you only enrolled the high risk, as we've discussed before. Or the group you enrolled did have better outcomes and utilization, but those 60% you missed sure hit the ER a bunch, and if included in your score analysis, you had no impact. A high enrollment and participation rate requires one to sell. In terms of sales, there is much we can learn from other industries, particularly companies like Amazon, eBay, Walmart, Netflix, etc. They know how to get us into their system and push the buy button. Their algorithms are something I've always wanted to get a hold of and apply to healthcare. These companies' ability to understand and segment the population to get them to buy is impressive, and that's why we look to gather as much data in the survey stage for segmentation. What are the motivators? Here, we can use behavioral economics. Behavioral economics studies how people make decisions in real world situations, acknowledging that our choices aren't always purely rational. This knowledge is being harnessed in population health programs to sell people to join the program and maintain their participation. By understanding factors like framing, social norms, and present bias, program designers can nudge individuals towards healthier behaviors. For example, highlighting the benefits of joining the program in familiar terms, or showcasing participation rates to create a sense of social responsibility and offering immediate rewards for signing up can all increase enrollment and ultimately improve population health outcomes. In the disease management programs we ran for numerous state Medicaid agencies, we learned that a $10 gift card, say from Walmart, was a great incentive, and we saw enrollment rates in some programs in the 80+% range with low disenrollment or loss rates once we had engaged them with their primary team of a nurse and community resource coordinator. These gift cards were offered for completing an initial assessment with our team. Obviously, this $10 gift card was 20 plus years ago, but it shows the power of these types of approaches. In the end, you must tailor your approach to your population. Use behavioral economics as the nudge and establish relationships to maintain enrollment. Technology can clearly help to scale the sale, but relationships will keep your peeps. Thanks for watching and look for the next episode of the Population Health Cycle, Solve. If you'd like more information about this particular cell step, assistance with developing your program, or are looking for a speaker, please contact us at info@accountablehealthllc.com.